Wait a minute. Did I just hear you say that you don't have any issues with cooking and you've burnt food 3 times this week? Did you just say you have no issues driving, but you've had 2 accidents in the past month? Are you seriously telling me that you're not the one who put all your dirty underwear in the bathtub? Do you ever hear these things as a caregiver to your parent and you wonder, are they serious? Do they really not see this? In today's video, we're going to talk about this. Are you a caregiver to your aging parent and you're starting to think you're crazy? In today's video, we're going to talk about these symptoms that we often see in early dementia. It's actually a name for it. And we're going to talk about how some of these behaviors very much mimic teenagers. One of the ways that dementia can be looked at is in terms of the functions that are lost as dementia progresses. What happens in dementia is that the sequence or order that things are learned as a baby. So a baby comes into this world, the immediate thing they just automatically kind of know is to eat. Then they learn how to sit up, maintain their balance, they learn how to stand, and then they learn how to walk. And in dementia, it's kind of the reverse process of this. So when someone loses their ability to walk and then loses their ability to stand, usually the last thing that goes is their ability to eat. And it's kind of the normal process of everything shutting down, getting ready to pass. So you might have heard lots of people talk about their parent with dementia as if they're a toddler. And some of those toddler behaviors is kind of what they're seeing. I wonder if some of the behaviors we see in early dementia that are related to denial and lack of insight are similar to the teenage behaviors and lack of insight we see. So in today's video, we're going to talk about this phenomena that happens earlier in dementia, and we're going to relate it to the teenage years and come up with some strategies that maybe we can take from the teenage behaviors. The name for this denial and lack of insight into their own behaviors or actions is called Anosognosia. It's a big word that basically means denial that anything is wrong. When we experience our elderly parent acting like this rebellious teenager where they're not going to do what you recommend they do, they're in denial that whatever they did was real or had an effect on anything or anyone else. And this can be as hard dealing with your aging parent as it is dealing with a teenager. Anosognosia can really look like your parent has no idea of the actions they're doing. So they might be driving, they might have had multiple accidents. They don't see it as a big issue, or they might be hiding their undergarments. They'll deny they do it when you find them, or they do just really dangerous things that make you want to bang your head against the wall. So this lack of awareness, although similar to a teenager's, is for a different reason. So in our teenage years, that lack of insight is from an immature nervous system. It's also from striving to gain independence and from a lack of experience in the world. They haven't had enough experience to see the repercussions of things. But in dementia, they truly cannot make the connection between what they do and the resulting consequences. There's a disconnect. So if we understand this difference, then it can help us in understanding what we're seeing and maybe also help us to come up with ways to communicate better to make things a little easier and make them a little safer. So just like with teenagers, allowing them independence while trying to keep them safe is like a balancing act. And it's the same thing with our elderly parents. So setting boundaries is something we often have to do, but because they're adults, the best way to get them to actually come along with us is to get their input. So I think it's really important to have the conversation about what we're seeing while not expecting that they're going to agree with us or understand even what we're seeing. But if we can have a conversation, this is what we're seeing. It's okay if you don't see it also, but part of my job is going to be to try to make sure you're as safe as possible. So I'm going to ask you if you'd be willing to do certain things. As this conversation continues and your parent maybe says, I'm not willing to do that, ask more questions. Ask why. Ask if they think that there's a point in life that they ever would need help. Ask them even to think back about their parents and the experience they had with them. Was there ever something similar where they really were trying to help their parents and they just weren't seeing it? Any way that you can kind of help your parent to see what you might be seeing. So also with our elderly parents who are in the beginning stages of dementia, similarly to a teenager, there can be a lot of mood swings. and personality changes. I think a lot of this happens because there's so much confusion within themselves and so much frustration, they often externalize it. And I think especially if someone's personality, although this isn't always true, especially if someone's personality was always where they kind of lashed out when they were feeling frustrated, that often will continue in dementia. But a lot of times the exact opposite will happen based on whatever area of the brain is affected or the areas of disconnect are. Some people have a totally 180-degree switch in their personality. But if we can remember that these personality shifts are because of the disease and not a personal attack against us, that sometimes can help. When it comes to communication with someone with anosognosia, think about patience, empathy, and strategy. Patience is one of the hardest things because we're usually in a time crunch trying to get a lot of things done, trying to do the other things that we have to do in life. It's sometimes hard to be patient. One of the things that sometimes helps is to remind yourself to be where you are. A lot of times in our mind, we're already on the 5 things that we've got to do while we're caring for our parent. And this just adds to our frustration and our sense that we have to hurry. We can kind of train ourselves to be patient, even if it's in a moment where we're just helping toileting, by putting all of our attention on where we are now, on the communication with our parent, and on the tasks that we're doing. It's easier for some of us more than others to feel empathy, but trying to picture ourselves if we were in that situation with these disconnects happening in our brain can sometimes decrease the level of frustration we have while we're communicating. And some of the strategies we can use are to use clear, simple language, try to be in an environment that doesn't have a lot going on so that you and your parent can both focus on what you're talking about, and pick your battles. So if there are things that are not as detrimental maybe to their health or to their safety, maybe those aren't the first things that you tackle. And include your parent in the conversation, allowing our parents to feel like they're participating in decision making and not just being forced to do something is going to make it easier. They don't even have to fully understand what's going on, but being able to have a connection, a trusting connection. If your parent trusts you, then it's much easier. Having a conversation where you're asking their opinion, you're having kind of a back and forth conversation, you're asking lots of questions, makes them feel involved, and results will be better if they feel like they're involved in the decision making. I'd love to hear your thoughts on this early stage dementia denial that anything is going on related to some of the teenage behaviors we see. Hopefully this video was helpful. If it was, please like and share, subscribe to the channel, and in the comment section below, add any comments about what your experience has been or any stories you have. Thanks.